In a new rule about coverage of contraception, the Trump administration argues that birth control is bad for your health. That's a claim that doesn't stand up to scrutiny. It's also the topic of this week's Healthcare Triage. The new rule weakens the mandate for health coverage of contraception under the Affordable Care Act, giving more leeway to employers with religious or moral objections. It's a move with many legal and economic implications, but my interest here is with the science, specifically with the assertions made by the Department of Health and Human Services about the benefits and harms from contraception. Page 44 of the 163-page document begins with an effort to dismantle many of the arguments used to justify contraceptive use. It first focuses on unintended pregnancies, reviewing some of the studies from the 2011 Institute of Medicine report to justify its assertions of complexity and uncertainty in the relationship between contraceptive access, contraceptive use, and unintended pregnancy. There's no uncertainty in the fact that contraceptive use significantly reduces the risk of unintended pregnancy. There's also no uncertainty in the fact that increasing access to contraception increases contraceptive use. The question most on point is whether the mandate to provide free contraception to all women in the United States provides a benefit. The HHS department notes that from 1972 through 2002, as, and I'm quoting, the percentage of sexually experienced women who had ever used some form of contraception rose to 98%, unintended pregnancy rates in the United States rose from 35.4% to 49%. This statement cites 3 different sources for those 3 percentages, and even then it cherry picks the facts. It's not surprising that nearly all women who are sexually experienced have used some form of contraception at one point in their lives. What matters is whether they use effective contraception regularly. The ending date of 2002, when we have much more current data, is also strange. If we looked more recently, we'd see very different results. In 2011, the unintended pregnancy rate hit a 30-year low, and the teenage pregnancy rate and teenage birth rate right now are at record lows in the United States too. This is largely explained by the use of reliable and highly effective contraception. In addition to arguing against the positive benefits, the HHS rule also argues that contraception is associated with negative health effects. First, it highlights the side effects of hormonal contraceptives. Those are real and include spotting, nausea, and even potentially mood changes, as we've discussed in a previous episode. But if the government were to use the mere existence of side effects to decide not to cover therapies, there would be no therapies to cover. All medical treatments, including all drugs, have side effects. Every health decision weighs benefits and harms, and birth control provides benefits beyond preventing pregnancies, including reduced rates of some cancers, regular cycles, and reduced bleeding and menstrual cramps. More important, the report argues that enrolling families who object to contraception may, and I'm quoting, affect risky sexual behavior in a negative way. The citation supporting this assertion is a law review article published in 2013 saying that much of the research in favor of contraception lacks proof of causality, and that other research supports the idea that normalizing sex through easier access to contraception increases the likelihood that teenagers will engage in risky sex. In 2014, researchers published results from the Contraceptive Choice Project, a prospective cohort study of more than 9,000 women, more than 4,000 of whom were 14 to 24, who were at risk of an unplanned pregnancy. They were given long-acting reversible contraception at no cost and followed for 2 to 3 years to see what would happen. The number of women who reported multiple sexual partners in the last month went down, not up. There were no increases in the rates of sexually transmitted infections. Further, if we can get beyond a war of hand-picked studies, we can look at what has happened in the real world. The proportion of teenagers who ever had sex dropped to 41% in 2015 from 47% in 2011. The proportion who are currently sexually active dropped to 30% from nearly 34%. The proportion who had sexual intercourse with 4 or more persons dropped to less than 12% from 15%. The percentage of those using long-acting birth control, however, has been increasing. One of my colleagues at IU School of Medicine, Dr. Jeffrey Piper, who's also chairman of the Department of Obstetrics of Gynecology and an author on this choice study, told me, and I'm quoting, There's no evidence that contraception increases high-risk sexual behavior. Disparities exist in family planning as in almost any aspect of healthcare. A 2016 study in the New England Journal of Medicine showed that the unintended pregnancy rate among women who earn less than the federal poverty line was 2 to 3 times the national average in 2011. An earlier study showed that in the years before, that rate was up to 5 times higher. Effective long-acting birth control can be expensive. First dollar coverage, or coverage without any copays or deductibles, was what women got with the Affordable Care Act, and it's a requirement the Trump administration's new rule undoes. Such coverage can offer women who don't have upwards of $1,000 of disposable income options that they otherwise wouldn't have. The proportion of women who had to pay out of pocket dropped from more than 20% before Obamacare to fewer than 4% in 2014. Women saved more than $1.4 billion in 2013 alone because of this change. Dr. Pipert added, quoting again, "From a societal perspective, contraception saves healthcare dollars. Every dollar of public funding invested in family planning saves taxpayers at least $3.74 in pregnancy-related costs. It seems clear that providing contraception is a cost-saving preventive service and benefits public health." Many things remain unclear with this new rule. We don't know how many women will actually be affected by it. One survey showed that more than 10% of employers with more than 200 employees would stop covering contraception if it wasn't required by the ACA. It's not clear, though, how many would actually follow through with this. The administration estimates that only 9 employers who use the accommodation process now will make use of the new rule to become fully exempt. They think fewer than 10 employers will end coverage based on the moral objections. They believe no more than 120,000 women would be affected overall. Regardless of the numbers, many advocates assailed the new order as an attack on women's rights. It's notable that one of the arguments the administration uses to support the move is that the government already engages in dozens of programs that subsidize contraception for low-income women. The government's trying to reduce funding for many of those programs as well. There are also certainly procedural and substantive legal issues with this change. We aren't going to settle many of those arguments here, but we can move the scientific and medical ones forward. There's ample evidence that contraception works, that reducing its expense leads to more women who use it appropriately, and that using it doesn't lead to riskier sexual behavior. Sometimes talking about drugs and sex education and health insurance aren't advertising friendly, and making those important videos could actually hurt our bottom line. Healthcare Triage is made possible in part, therefore, by our supporters at Patreon. The support we receive from our patrons at Patreon allows us to keep making those kinds of videos without worrying about ad revenue. So thanks to all of them, and particularly thanks to our Surgeon Admiral Sam and research associates Joe Sevitz and Joshua Crow. If you'd like to support the show, we'd really appreciate it. You can go to patreon.com/healthcaretriage. While we're asking you to do stuff, please consider subscribing to the show, consider buying some Healthcare Triage merch as the holidays come up at hctmerch.com, and I've got a book coming out November 7th, The Bad Food Bible, available anywhere you'd buy books, and I'd really appreciate your picking up a copy.